I enjoy making the efficiencies better. That's what I really enjoy doing. To go in and take a look at numbers and look at the analytics of the practice. I can take a look at about 9 different things in a physician's practice and say, this is what you're doing, this is what you're doing good, this is what you're doing wrong, or this is what's going on in the practice. I want that all to be taken care of so the physician doesn't have to worry about any of the other stuff that's going on. He or she could focus on the patient. From the business side of it, our goal is to make sure that the interactions between our physicians, patients, and customers, they're perfect.
Hey everybody, welcome to the show. I'm Karen Simmons. Today I have Jerry Golden on. He'll be discussing organizing a bunch of companies and controlling the chaos. Before we start the show, I'm excited to announce that we have a new sponsor for this podcast, and it's DocRx. DocRx is a family-oriented company dedicated to tailor operational solutions for patient health and compliance programs that increases the quality and efficiency of patient-centered care, and always with the mission of the patient's health first. With over 10 years of experience helping doctors and their patients with diagnostic testing, patient monitoring, medical supplies, compliance, wholesale pharmacy, physician dispensing, billing, and much more. DocRx is your patient and health compliance solution, both under one roof. To find out how DocRx can help you, your hospital, pharmacy, or physician's office, see all their services at docrx.com. That's DOCRX.com. Now on to today's show.
Hey, I'm Karen. I'm a former CPA, entrepreneur, business consultant with big ideas.
Welcome to Cheers to Business.
Jerry Golden, welcome to the show.
Well, thank you. I'm very glad to be here.
Tell the name of your company and what you do.
So I have Coastal Neurological Institute is a group of neurosurgeons and neurologists. Again, it's been in 60 plus years. Obviously, your neurosurgeons, those are your brain surgeons. Those are the ones that take care of anything head and neck related. We do a lot of spine, neck, thoracic, and lumbar spine surgery. So they specialize in that. Restoration Health, those are my 2 interventional guys. That's Dr. Rayner and Dr. Thomason across the bay, 2 fabulous physicians. They are interventional, what they call physical medicine and rehab physicians, physiatrists. They do your cervical, thoracic, and lumbar epidurals and all sorts of different procedures instead of your classic pain medicine physician that's just doing pain medications. They do a lot of other interventional procedures such as obviously the epidural, steroid injections, nerve blocks, that sort of thing. OHC, obviously that one's very exciting. That's straight occupational medicine. Think of your industrial athlete. Think of those folks from an industrial standpoint. I think of the large companies, Chevron, Austal, Evonik. Those are very talented and very well-trained staff and employees that to be able to do what they do and create the products they create. Well, our job at OHC is to make sure that their health is maintained. Obviously, there's certain reporting and monitoring, things that need to happen for those, think hearing, respirator fit testing, that sort of thing. So OHC, strictly occupational medicine. Do a lot of drug screens there. We've been doing a lot of COVID testing. We're using Coast Diagnostics for that as far as making sure somebody's negative before they can go back to work, basically. We have an ENT practice down in Foley. That's Dr. Cowell. That's ENT Centers of Excellence, and he's got an audiologist in with him, Jessica Pruitt. And then we have Dr. Schnitzer here in Mobile. Dr. Schnitzer is a straight PM&R physician, physiatrist that just handles pain management and musculoskeletal issues here in Mobile. And so during that process, it became clear that sharing resources between clinics and trying to keep all the accounting, as you well know, who's on first, what's on second, and whose bucket belongs to what. Keeping all of that separate was going to be a whole lot easier underneath a management company. And so we started Forefront Medical Management last year. And so the staff now works for Forefront, and then the physicians and the mid-level still work for the individual clinic. And so that allows us the flexibility to adjust staffing as needed per the clinics, as well as be able to take on new clinics and help them either pick one, any particular business issue, or to bring on the new clinic to be able to basically run more efficiently and more productively. The nice part about that is we're being able to share or at least have a little bit more say-so with the vendors by having a little bit bigger hammer to swing with just from a vendor standpoint.
That's a lot to keep up with.
It has, yeah. But again, I couldn't do it if I have a absolutely fantastic team of people, and that affords me the ability to obviously run these practices and really try to run them well.
It's pretty powerful to be able to organize a bunch of different companies, seeing needs, setting up the entities, the chaos of the accounting and separation that's needed. What's some good things you guys have put in place to help you do that?
The first part has been that we had a good base to begin with. Obviously, when you start off in a good standing, it's a whole lot easier to move things around. I have an absolutely wonderful team of people that work with me day in and day out, and it allows me to dive into each particular clinic. I enjoy making things better. I enjoy making the efficiencies better, showing the physicians, hey, look, if you added 2 more slots into this particular schedule, you would do this much better. But I would not be able to do that if I didn't have the help that I have. I have a young lady by the name of Lacey Tomlinson and Mary Coleman that do a fantastic job, and they help keep all of those buckets and all of the different expenses separated. And so we do that by really running things day in and day out. We don't deviate from our day in and day out procedures too much. And the reason being is I think, again, we're not launching the space shuttle around here, but what we are doing requires time and attention in that detail. As you know, as an accountant, you got to make sure, and the doctors want to know, and the individual practices want to know that these are my expenses, this is the revenue. And so we kind of take an aggressive approach to that and make sure that each and every month that stuff is done, balanced, and then we even have an outside healthcare accounting group that goes back over and looks at it again, and then I look at it at the end of the month.
Now, I think it's so important because, and it doesn't matter whether they're lawyers or electricians or doctors. They can be very good at what they do. They can be great at doctoring, great at being an electrician, but do they know business? And people really need that accountability of sticking to the business aspect of it. I see that lacking a lot of times.
Sure. I tell people, we run our clinics a little bit differently. We focus on the physicians. If I have to take care or talk to a patient, something went bad. And so I don't typically do that. But what I want to do is I want to make sure that the interactions between our physicians and our patients is perfect. I want that all to be taken care of so the physician doesn't have to worry about any of the other stuff that's going on. He or she could focus on the patient. CNI has been around for 60 plus years. The other clinics, some of them are relatively new and some of them are older. OHC's been around for 10 years and it's really doing well, but we focus in on our clients and our patients. From the business side of it, our goal is to make sure that the interactions between our physicians, patients, and customers is as best it can be. Obviously, given the times these days, it's been rather challenging.
Yeah, I bet. Being able to see the need, I can so see, there's big plants and bigger businesses, lots of employees. They mostly self-insure, and so they have their own pharmaceutical. They have big programs in place. And what I am finding overwhelmingly fascinating is the regulatoriness that you have to keep up with.
Yeah, that's a big part of it. Obviously, being able to do that now through the management company helps keep a lot of that. Dot your I's, cross your T's, and make sure you're doing all of that right. We certainly don't want to go near any of those gray lines, and we want to always do the right thing.
Well, it's easier for a management team. I like management teams actually, because, it's easier for them to keep somebody, legal for compliance that all the smaller clinics can reach out to, or certifications when you're getting certified for insurance. It's just smarter to have one expert that 15 places or however many can go to use that help, because not everybody can know everything and not everybody can hire an expert full time.
You think physician credentialing, just that alone in and of itself there are programs out there that do that, but they're pretty expensive. And typically that'll fall back on a billing person. But when your billing person's taking care of physician credentialing, then they're not billing for you. And so we actually were able to bring somebody on board with Forefront, and now we bill those services back to the clinics. It's saving them money, and the physician credentialing part alone is now a much less headache for my billing folks for individual clinics. So yeah, you're exactly right.
I love outsourcing. I've always done it. My daughter and I own a payroll company, and then my husband and I have a new courier business where we're picking up COVID tests. So I love outsourcing. I always called it. That's why I don't clean my own house. And I think businesses can use management teams just for that reason. I can do something I hate for 5 hours and complain about it, or I can go do what I love, make some money, and pay somebody very smaller amount to go do what I don't like to do anyway. That's
Sure.
Are there any clinics too small for you?
No, not really. I think obviously there might be some that are probably too big. Typically they have a CEO that's just on staff. But no, I don't think so. We just started, from the forefront standpoint back in October of last year. And I had talked about not bringing anybody on board and really just keeping it small for this year and kind of work out all the different bumps and kinks along the way and build my vendor network of people. I call it the team, build the team of folks so that when we do go in to either start a new clinic or to assist one in getting back on the right track, that the team of people would be together. We already have such a good team that we went ahead and brought the ENT group, Dr. Cow's group, on board in October of last year, and that's working out well. My wife, Vicki, is actually running that one for me. And so it's really kind of done a turnaround. So no, not really. I think we'll take a look at anybody, but the nice part about it is we are in a situation where we could tell somebody no. We don't want to work with people that are not serious about their business. There are two things about a physician you can't fix. They either are clinically unsound or they're a jerk. You just can't fix that with somebody. And so I got plenty to do. I don't need to work with a physician that he or she doesn't know what they're doing or they're a jerk. You can't help them much. But no, we'll take a look at anybody.
Yeah, sometimes their spouse can be difficult when they're working with them as well, I've found over the years.
Mine probably says that about me, but I don't say that about her.
I wasn't talking about yours, but sometimes when a doctor's wife is running the office or vice versa, and the husband's doing
I have seen those situations, and, again, I think you get, in some ways they work out just fine, and in some they don't. It's kind of a nightmare.
So you're saying there could be a doctor out there and he has a small clinic, and clinic being a doctor's office. Does he join your team?
No, what we would do is it really depends on what they need and what they want. Let's just say if they just want a little bit of my time once a month to go in and take a look at numbers and look at the analytics of the practice. That's what I really enjoy doing. I can take a look at about 9 different things in a physician's practice and say, this is what you're doing, this is what you're doing good, this is what you're doing wrong, or this is what's going on in the practice. And again, we're not launching the space shuttle. It's mainly, they're just certain things. If your days in AR are high, you either have a billing issue, a collection issue, or you've got a payer issue. And so there are just certain aspects of that you just kind of know what you're doing over time. You can take a look at it and fix. One of the things we've been able to do with Forefront is to put out a better benefit package. And so instead of buying all these, health insurance plans with small clinics, we were able to lump everybody together and bring them together under one plan. And now, we have a much, much better, we can offer 2 different plans to the staff and reduce cost for those clinics. And so, they still want to obviously work and bill through their own tax ID, but their staff now works for Forefront. So it's kind of an a la carte thing. We are working right now on a health cloud, on a cloud-based system. And so IT costs have gone through the roof. Probably, I heard the statistics last year that IT costs for medical practices were going to exceed their personnel costs. And I kind of chuckled at that at the time, but I think it's true. It's getting there. I mean, these smaller practices get hit every 2 years with $50,000, $60,000, $70,000 worth of IT work that they need, or computer work, hardware. And so we're putting together a local cloud system here just for healthcare clients. And so we're going to be moving all the cloud stuff. We've been operating our own cloud here for years and sharing it with other clinics, but now we're going to do that up at the RSA Tower in Montgomery and keep it up there in their hurricane-proof building. But now those costs can now be shared with other clinics and reduce that cost. And so that may be, one clinic. I've got a physician over in Fairhope now that's interested just in cloud service. It really just depends on what their needs are, I guess.
Well, you're going to need a separate company just for the IT part, aren't you?
I already got it. It's Jubilee Data Systems.
I'd really like to have coffee with you one day. He's very interesting.
You're way ahead of me on that one. Yeah, but yeah, Jubilee Data Systems, and we've already formed it, and we'll be making the move actually at the end of this month and moving everything over, and we'll be open, I guess, for bringing other physician practices. My goal with that is to, down the road, a lot of the hospitals and larger groups have always wanted to be able to put together a health information exchange. And really what that is to be able to share patient data behind a firewall, or where you don't have to try to make all these systems talk to each other. Well, if you do that behind the cloud, and obviously there's all that Star Wars stuff that needs to happen to keep it all safe that I don't know anything about, but now we can do that, and your family practice guy can now have the opportunity to send the cardiologist or the ENT or the neurosurgeon or the neurologist, whatever it may be, those patients' notes without trying to go around your elbow to scratch your knee to get medical records. It's just crazy. We can send a package halfway around the world overnight, but we sure do make it awfully hard to get patient medical records around.
I remember when the electronic medical requirement came out and they were going to give tax credits. You went to that system with, whatever time frame they had, and then that changed. But, so is everybody now required to be on the electronic medical?
Well, you get penalized if you're not. You're not required, but you're going to get penalized if you're not. Medicare's not going to pay you the same as they pay people that do. So, we've got the different, MIPS and MACRA and some of the other reporting requirements. I think some of them have been, I say they've been delayed, but actually they've not been delayed, but because of COVID, but you're going to get hit if you don't have it. And it's really tough to operate. Obviously, I think it's, yes, when the computer world or when your IT systems are not working the way that you want them to work, you obviously would love to be able to give everybody a yellow pad and a piece of paper and a chart and be able to get it done. But, it's just the world we live in, and it's not going away. But there are things that you can do to help mitigate the cost, reduce the cost and not be stupid about it, protect your patient's data, and make it work efficiently for the physicians. And so that's really will be our goal with the new cloud-based system. Just do it the smart way, and it doesn't have to cost the physician's practice a ton of money. That's our goal there.
Yeah, I think this stuff is great, to see the need and be willing to evolve with it over time into what different areas that's needed, and then set up the companies to make it happen. Between all the clinics, all the companies, how many people do y'all employ?
97 with Forefront, and then obviously the physicians. I do have some of the clinics that have not come on board with their staff yet. The ENT practice has 2 that's still on their staff, and then I have 5 that are down there that are on ours. And then Dr. Schnitzer, I have a manager over at Dr. Schnitzer's office, and some of his folks are still on his payroll. And so it just depends, but I think we're at 97, around there.
When COVID hit, what was y'all's first response as clinics? What was the knee-jerk reaction that this is here?
From our standpoint, we really didn't shut down any. Number one was, my first foremost goal was to keep everybody employed. I did not, but we were close. We didn't have to, thank goodness. We were very close to having to lay people off. And so obviously the PPP stuff worked out well. I think that was a fantastic program that the Trump administration came up with to get money out to people that were employing, that were small businesses. But first and foremost, my goal was to make sure I didn't have to lay anybody off. The second was obviously to take care of our patients and keep our folks safe. So we were able to send most everybody home right away because of the IT systems that we already had in place. We were really ready with most everybody within a day. So we got that covered. So that was the first thing. And then the telemedicine helped out tremendously. Obviously, the loss of elective procedures for proceduralists, so when you're talking Restoration Health or the neurosurgeons here at CNI, that was a big hit. I mean, that was a huge hit for those guys. But again, being able to take care of patients, part of it was kind of nutty as far as with the hospital. Again, I'm not a hospital guy, but there were patients that we couldn't take care of from an elective standpoint because, they had shut elective procedures down and the hospital had 3 people in it that had COVID. Again, I think the big thing was keep our people safe, keep them employed, keep the team together, basically, so that when we got through it, we could, keep everybody here and, all the systems and the people and that work so well together, keep it in place and be able to crank back up again pretty quickly.
Yeah, I thought that the PPP money was absolutely on target. It really, really was. I know my brother and I own a manufacturing company across the bay. We build manifolds and heat exchangers and ship them all over, and we never let anybody go. Italy sells with Spain, and then the others we took the hits, but the PPP money allowed us until sales could kind of come back up a little bit just to keep everybody employed. That was the biggest thing because none of us can do what we do without our teams, ever.
Yeah, you can't do it. You're exactly right. Hats off to you for making that happen because it's these people are like my family and I love them and to have to tell them, hey, look, we got some weird virus running around and we don't know what the heck's going on, but we've got to shut down. I got everybody together and I said, look, it's the Department of Homeland Security has 16 people on this list that they deem essential, and healthcare is at the top of the list. It's time to ante up and kick in. Who doesn't want to do that? And none of my folks said, hey, I don't want to do that. I don't want to be here. They all anteed up, kicked in, and we took care of patients while we could. The physicians, were going to the hospital, getting all gowned up and doing what they had to do to take care of folks. And so in my respects, it was easy. I walk in my back door, I'm in my office, but these physicians and nurses and frontline staff and what they're doing at the hospital and obviously with the patients has been amazing.
Now your admin part, accounting, billing, that kind of stuff, are they working from home?
Yeah, some of them still are. So I've got some training that's going on today with some new folks. Some of them are here, but for the most part, they're at home working.
I found no one at Payroll Vault wants to come back to work. They all like it at home. And what I've seen, DocRx and some dispensing, and some of the other companies, what I've seen is that depending on personality, that a lot of people are more productive at home.
You're right. It's personality. You're exactly right.
Yeah, some people need that structure of be here and you have to work 8 to 5. That was a hard lesson growing up. And I say growing up in the CPA world was, there was a bookkeeper and she would leave at 5 o'clock no matter what was on her desk. And I could not wrap my head around how you could do that. I was complaining about it to Mike Sermon, and he says, why in the world would you expect anybody to work as hard as you do? You're going to have 8 to 5 people, but you need them, so get off their back. And I went, wow, that was smart.
Lesson learned, right?
Lesson learned, and I've paid attention. Lesson, note to self. And so, I've tried to remember that with the different personalities. We are there to run a business. We're not there to be people's friends. And I tell people in interviews, I'm not going to jewelry parties, candle parties, or your kids' birthday parties. I've got friends. This is a business, and this is what we got to do. And here's what's expected. And then give them the tools and training. So I like hearing, you guys must have a ton of training going on.
We do. Our billing process is, again, a little bit different probably than some of the other clinics out there. Again, we're all filing claims, right? We're sending something to a particular payer in a particular format, but our goal is to send it out right the first time, have that done in a very efficient manner, to be able to, not be in a situation where we're sending a patient a invoice, because again, if you're collecting at the time of service for a service that, you are performing, you should be able to collect on it at that time of service and understand what you should be billing. Not to say that we don't send statements, we do, but again, that process from A to Z, again, whether or not you're filing surgical claims, office visits, or whatever, it's still the same type of claim. It's still the same deal. So you can get really, really good with that. Then again, you're doing that each and every day. There's no deviation from that. You have to do these particular components each and every day. When you do that and you do it the right way, it doesn't matter if you're a neurologist, PM&R physician, family practice, OCMED, whatever, what you're putting on the code from a code standpoint will be different, but that process really can be the same. And we just have found a process that works very well. So when you plug that in, we're training those other folks our process. We're not doing it, hey, that physician or that practice has called us because there's a problem or there's a reason that they've called us. We're not going to continue to do the same bad thing. We just know a system that works very, very well for us. Now we're going to train them how to do it. We're always kind of training. We're big on sending our people to the trainings. The doctors really support us on that. You always get one pearl or nugget out of those events that really help you down the road.
Oh, yeah. I'm a big chain of command. And when I'm doing consulting or CFOing for companies that have multiple companies, they try to treat them all together like they're the same, and they're not. You have to take these separate entities and make them full functioning, independent. That makes the success of the enterprise go. Because if each individual one can be, your one that's in the cloud, the IT, it can service people all over the place. Whereas the billing company can service different, so it makes it all more successful when you can put the right chain of command in place in the processes. Because I hate double work. I hate somebody putting something into an accounting system and then going and doing a spreadsheet. Why the heck would you do it twice? Figure out a way to get what you need out of one system.
Yeah, people touching something multiple times to get the end result doesn't make a lot of sense.
Hell, it's bad enough you got a human touching it one time, let alone more than once.
Exactly.
Your odds are not in your favor. Put it that way. All right. Well, Jerry, we're coming into the end of the show, and I want to thank you for coming on and tell who benefits from what you do, and then how do they get in touch with you?
I think the thing that people would benefit most from us is you're going to get the truth. You may not like the truth, but you're going to get the truth on how your practice is running and what we feel like we can either do to fix it or what you're going to need to do to fix it. I have a cell phone, or my direct office line is 251-662-3730.
Yay, I really want to thank you for coming on the show. And on this show, what we do is it's cheers to business. And I usually have a bottle of wine, and it makes it Zoom. It's hard to drink together. Right now we're at 11 o'clock in the morning, but usually we do a cheers. It's cheers to you and your team for seeing needs and putting things into place that actually service that need. I've always said, if you can find a need, that's a win-win-win. Win for me, win for you, win for those around us, and then price it fairly, you have a winner and you have a business. And you are the epitome of that statement. So thank you very much. Cheers to you.
Well, thank you, Karen. I appreciate that.
Please be sure to subscribe to Cheers to Business podcast on iTunes or anywhere else that you get your podcast. Visit our Facebook and be sure to give us a like. And if you have any questions or topics you'd like us to discuss, shoot us an email from the website cheerstobusiness.com.